Hi, I'm Jodi Hansen. I'm a parent of a 26-year-old profoundly autistic son. His name's Dayton. We're from Wausau, Wisconsin, and I would like to share his story. Hi, I'm Jodi Hansen. I'm from Wausau, Wisconsin, and I have a 26-year-old son named Dayton who is profoundly autistic. In 2021, Dayton got sick after COVID. 6 months it went before, in and out of emergency rooms, before anybody diagnosed him with cellulitis in his throat because he had strep that wasn't caught. Weeks later, after that was treated, he ended up with a movement disorder, which now we were told is PANDAS, rheumatic fever with chorea, tremors. We've done so many treatments for our son. We've tried to reach out to functional medicine doctors. We tried to go to hospitals, Mayo Clinic outside of our state, but nobody will take my son. Nonverbal, autistic. We know that he probably has excited catatonia. However, when we presented that to our psychiatrist, Dayton had a meltdown at the time and they ended up calling the police. The police wanted to take him to jail. Why are you going to put a nonverbal kid in a jail, I said. And they said, because domestic abuse is domestic abuse. We ended up saying we were going to get a lawyer. They ended up backing down. They wanted us to put him in a state hospital now because they said that's the only way they would ever know if it's excited catatonia. But even then, they said profound autism and excited catatonia looks the same. So we put him in a state hospital. We may never get him back. So that's why I'm sharing his story today, to help bring awareness. Some of the things that I wish more people knew about parents or caregivers of intellectually disabled severe kids is that it's a constant battle of worry all the time. Are they sick? Are they hurting? What doctor is going to listen today? What doctor can I go to? Why do I have to be a prisoner in my home? Why can't I get more help? Things I wish more people knew. The family sacrifices that need to be made for your loved one with severe autism. What the siblings need to give up, what you need to give up. The constant worry that goes in from day to day. If your child is hurting, if they're sick, how to help them. The constant battle for medical to even exist with your kids, or dental. The constant battle of needing resources and help to build a village. The ideal change and the biggest change, and something I dream big about, is that every state would have a multidisciplinary clinic or hospital for our kids. Our kids are human beings. They deserve a neurologist, immunologist, rheumatologist, etc. They need to have a team of doctors, just like we need a village to raise them. We need a system in the medical system that works. The biggest change I would like to see is the gaslighting. When you're saying to somebody, please, something's wrong with my kid, the gaslighting needs to stop. The doctors need to listen to the parents. We are their voice. I would love to see multidisciplinary clinics open all over the United States for our kids to have access to neurology, rheumatology, immunology, PCPs, dental, all in one spot. Our kids can't be going to constant appointments and waiting like a normal child. That's too much. It's too much for the families and it's too much for them. We need to have this team of doctors that are invested in them. And if anything, I pray that that is the number one thing that I would like to see happen for our kids.